We're going to show you a couple of patients today to demonstrate teeth problems in pets and why it's important to take care of your pet's teeth. This is because we're heading into this month of dental health care, which is February of every year, to make people more aware of how important it is to take care of their pet's teeth. So first we have our first patient here, and before I show you the teeth here, I want to go through the what happens with teeth and how it's very, very similar to our teeth. Number one, when dogs get tartar on their teeth. Now tartar is same thing as plaque. It's this little mineral deposits that look kind of brownish on the surface of the tooth. When they get on the teeth, that tartar eventually gets up under the gums and causes gingivitis, inflammation of the gums, and eventually infection in the gums. Once we get infection in the gums, the tooth attachment, what we call the periodontal ligament, which attaches the tooth to the bone, becomes damaged, and then dogs will lose their teeth prematurely. Bad teeth also can lead to other problems, though. Besides loose teeth and toothaches, which is a big problem, once the bone is infected, there's going to be pain associated with that. But one of the more important things that we've learned over the years is that bad teeth, infected gums, gets into their bloodstream and can damage their heart, their kidneys, and their other internal organs. So it's more than just making their teeth look pretty and their breath smell good. Taking care of the teeth also helps keep your dog alive longer and keep them more comfortable. So that's why it's become a big thing, and that's why February is now the teeth awareness, dental healthcare awareness month for pet owners. So let me show you first here. We have our first very friendly, a little bit scared patient. And what I'm going to do is just kind of see if we can show you the teeth from the side. Now, you'll notice on these teeth, these are pretty normal. We only have a very small amount of yellow discoloration on them, but otherwise they're very white. The gums look real healthy. You'll see a difference when we compare them to our next patient. They're nice and pink. There's no red spots on the gum. Okay, something most of us could just look at home. You don't need a degree to be able to tell whether there's something real obvious with your pet's teeth. Okay, so this is Marge, our second patient. And what I'm going to do is show you with Marge how our teeth look. So if I pull back the gums here, now first of all, you'll notice, if you can kind of remember what the last ones looked like, there was more pink. Now we see a lot more red here, so we're starting to get gingivitis. You see the yellow on this tooth, all of them have little bits of yellow on there. I can even take my finger and I can probably break off a piece. So here's a piece of tartar that actually came off from the tooth to give you an idea what it looks like. So then when I do that, you see what the tooth is supposed to look like underneath. So that is the next stage of what happens to the teeth if they're not cleaned at this point. Now at this point, all the teeth are they're solid, they're in place, they're not loose yet. So the ligament that attaches the tooth hasn't been damaged yet, but we do have gingivitis. Okay, so here is our next patient. This next patient is, we'll just call her Cutie. We don't have a name for her yet. So to show you her teeth, she's not quite as happy about us touching, but this gives you an idea of what the next stage is. Okay, so in this stage, you can see that we've got a lot of tartar right where my finger is here. A lot of tartar on this tooth, a lot of tartar on this tooth, a lot of tartar on this tooth. The other thing is, you notice there's only 3 teeth visible right here, but it's because we've already lost a couple of the teeth. So we've already entered the next stage where some of the teeth have gotten infected, they've fallen out. And the question is, by then we've already have damage to the kidneys and the liver and the heart from infection that would have gotten into the bloodstream. Because one of the things that happens is when the gums have really good blood supply, and that's why an infection in the gums, it has more chance of getting into the bloodstream than an infection, say, from a cut or something else on the skin. It's because of the blood supply here. So this is the next stage. And then after this stage, what will happen is eventually all the teeth will fall out. So this dog is actually overdue for a teeth cleaning. We're past the point at which it's ideal to, we want to clean those teeth before they lose the teeth, not once the teeth are already fallen out. All right, and here is our last patient, Casey. Now, Casey is to the point of no return, okay? I'm just showing you Casey just to show you, once the teeth have gotten really badly infected, you're left with no teeth. So Casey actually has no teeth at all. However, when you look at the gums, they're not nearly as red and inflamed as the other 2 dogs that we looked at. which tells us, that's okay, Casey. It tells us that even though Casey has no teeth, she's actually in a lot better condition at this point than those two previous dogs. The two previous dogs over time have had toothaches, have had infection in the gums, and when that happens, since the teeth were not taken care of, there's going to potential for shortening of their life from bad heart or bad kidneys as the dogs get older. So in this case, this dog's teeth were pulled because they were infected, and even though most people would think it's bad to not have any teeth, what are they going to eat? Dogs without teeth can eat canned food very well, and as a matter of fact, many of them can eat dry food. They just learn to gum it, and they still eat dry food, which is a surprise to most people. It certainly does not decrease their quality of life. As a matter of fact, now that they're pain-free and feeling good, these dogs live great lives. So there's nothing wrong with no teeth. Ideally, we would all like our pets to have their teeth though, but the only way that's going to happen is if we stay up on having them cleaned. And then the other thing you can do is brush the teeth, and that's the next thing I want to demonstrate for you. All right, so we're going to bring our first patient back in and show you how to brush the teeth. Brushing the teeth is the most effective thing you can do at home to help control tartar buildup on the teeth. And by the way, everything that I'm talking about here with dogs is also applicable for cats. So all you cat lovers out there, the only reason why I'm using dogs here is their teeth are bigger so we can see them better on the camera, but the same things apply for all cat owners out there. And as a matter of fact, cats also get cavities of their teeth, so they actually have additional problems besides the tartar problems. And one thing I want to mention too is that working at the shelter, we see a lot of teeth problems in dogs and cats. These are just your average everyday dogs. This is what most people are dealing with at home, and we see a lot of this. It's a very, very common problem. These are not uncommon things. Most dogs have some degree of tartar on their teeth, and make sure you pay attention to what your dog's teeth look like and your cat's teeth look like, and make sure you have them cleaned at regular intervals when your veterinarian tells you to. And by doing that, you're not only keeping them alive longer, but you're also keeping them comfortable as they get older. All right, so let's quickly get back to the brushing the teeth. When I brush the teeth, the key is it has to be a pleasant experience for the pet. The way you make it a pleasant experience is you use a toothbrush that's comfortable and you use toothpaste that they like. Toothpaste that they like means it's not people toothpaste. People toothpaste has detergents in it and they're not supposed to swallow it. Pet toothpaste does not have detergents in it. It's safe to swallow and it's flavored. So there's different flavors. Chicken flavor is one of the best flavors that I've found. That's what my dogs love. So that's what we use. So what I do is I open the mouth, and you can pull the lips back, and then you take your brush and you brush the outside of the teeth. Now you notice I do not pry the mouth open. When you pry the mouth open, they don't sit still for that. And a dog that's not going to sit still for it, I find people don't continue to brush the teeth if the dog's not cooperative. So you want to make it a pleasant experience. So just pull the corner of the lip back, use your brush to brush the teeth. Now I don't have some of the toothpaste with me, but normally when they taste the flavor of the toothpaste, they like it, they think they're getting a treat, so they actually look forward to having their teeth brushed. Now every dog and cat is a little different, so not all of them look forward to it, but most of them do. So that's kind of just a quick rundown on how to brush the teeth. The frequency of the brushing needs to be at least weekly, preferably every day. It's best if it's every day, just like you and I. Feeding dry food, milk bones, chew toys, all those things help too, but based on recent studies, the best thing you can do at home is brushing the teeth, and that's something that I don't see people doing as often as they should. And then periodically, once a year, when you go into your vet for your annual physical, have them check the teeth, and they'll let you know when it's time to have the teeth cleaned. Average dog, it's about once every 2 years. Some of them it's often as once a year, or even sometimes a little more. And other dogs, it's once or twice their entire life. It really depends on the dog. Unlike our dentist, there isn't really a hard set rule on how often it needs to be done. If you have any other questions about your pet's health, make sure you contact your vet. If there's any questions we can help you out with, please feel free to contact us. Also, lots of pets that are available for adoption. Feel free to contact us at sccmo.org, or you can reach us by phone at 636-949-PETS.
Thanks to Dr. McCool and the St. Charles County Pets Adoption Center for that information. When we come back, some life savings information from the St. Charles County Ambulance District.